Thank you for coming, both those who are here and those who are on our Zoom connection. For those of you not familiar with Capital City Village, this is one of our periodic education outings. Capital City Village has been around for about 11 years, and our goal is to really help folks. I guess the N word nowadays is age in place, but to do that sometimes takes support, simple things like home repairs, transportation, but we also really would like to emphasize the importance of friendships, building community. We do that through a managed meetings like, yeah, happy hour, as well as weekly coffees, as well as education and other programs, dominoes, just various groups. So we would invite you, if you're not familiar or would like to be interested, just go to capitalcityvillage.org and you'll be overwhelmed with the amount of things that Meredith has put on this kind of thing. But anyway, that's for us. Uh, I'm here to educate. Sorry, yes, I am here to educate you. I am here to introduce Dr. Lisa Doggett. There are so many things that in her knowledge base or her activity base, but I'm just going to emphasize what Tom McCourse thinks are important. Lisa is a wife. Her husband Don is here. She's a mother of two daughters. Uh, she is a socially responsible crusader, a health educator, and we now know a writer. Things. She is a graduate of McCallum High School, Amherst College, Baylor College of Medicine a year or two after me, and and I really think it is a truism. I think you're a graduate of the school of many gifts and hard knocks. And she is about to become a family physician with the Department of Neurology at the Dell Medical School. I had to make sure that you all get the family association. Dr. Libby Doggett, who's in the audience here, her mother was our speaker at KAW in 2021. And I did say I would do it anyway, but her father is a well-known congressman. Anyway, we are delighted to have you. Thank you for sharing your time. As is evident by the book, it's pretty tight in life sometimes. Lisa will talk for 30 or 40 minutes. We'll have time for questions. And also, if you have the slightest interest, and I encourage you to have more than the slightest interest, to buy one of the books. She does have those in the back. With joy, Lisa.
Thank you so much for taking part of your Sunday afternoon. It's a beautiful day outside, hard to be inside, to be here with me. And thank you, Dr. McCourse. Dr. McCourse has been a mentor and a hero of mine for many, many years, and it's really an honor to be introduced by him. So thank you, and thank you all for coming. We're going to start with just a few slides and just mainly pictures. And then I'm going to do 3 short readings that are about 7 minutes long, just so you kind of know what you're getting into here. And I think overall it'll be about 30 to 40 minutes, as Dr. McCourse said. All right, let's get going. All right. So the book is called Up the Down Escalator, Medicine, Motherhood, and Multiple Sclerosis. It took me about 12 years from starting point to getting published last August. It's been quite a journey for me, and I'll tell a little bit about that, but mostly I want to talk about my story and the book. So next slide. So I grew up in Austin, over very near here, first on Sharon Lane, then we moved over to Kennelwood Road off of Scenic. I went to McCallum High School, but I also attended Cassis right up the road here. I grew up in a family with 2 amazing role models. My mom and dad both have been in public service my entire life. My dad was elected to the state senate here in Texas when I was 11 days old, and has been in public life pretty much ever since. And my mom has been a nationally known advocate for children and families. Next slide. We are a family of activists, always learned from my parents to fight the good fight, to really look for opportunities to make a difference. When I was trying to figure out what I wanted to do with my life and my career, they said, you can do whatever you want, but think about how you can make a difference and serve others. So that was always in the back of my mind and a big reason why I chose to go into medicine as a family physician. Next slide. I grew up in Austin. I attended Amherst. Next slide. And then I came back to Texas to attend Baylor College of Medicine in Houston. This is me and Dawn at graduation. Dawn and I, as you'll know, when you read the book, we met when we were 18 years old. We went to medical school at Baylor together. He was a year ahead of me, which is why I'm the one in the gown here. But we've been best friends ever since we were kids, pretty much. Next slide. So I'm going to start out with a reading from from my experience in medical school. This is the first chapter of the book. So if you're going to start reading it, you're getting a head start. And this is my experience with my very first patient with multiple sclerosis, long before my own diagnosis, which I'll talk about in a few minutes. Okay, so this first chapter is called Mr. Sloan. February 1997. The man's arms and legs were shrunken, atrophied from disuse. His hands were twisted and stiff, curled into rigid fists. He moaned on the long white stretcher. I stood in the corner, shifting my gaze to the window, to the lights in the parking lot and the dark sky below. He used to be a soldier. This is a 56-year-old white male with a history of multiple sclerosis and hypertension, the second-year resident said. He developed acute lower abdominal pain earlier today associated with vomiting. Exam reveals abdominal distension and diffuse tenderness to palpation. Okay, so what's your diagnosis? Matt, the senior resident, asked. Well, obviously intestinal obstruction, probably volvulus. Sounds like it, Matt exclaimed, his voice eager at the prospect of operating. Volvulus, abnormal twisting of the intestine back on itself.
No, this is I'm listening to Lisa Doggett explain multiple sclerosis. It's not working now because
it's a bread and butter diagnosis and general surgery. But in the weeks since starting my required surgery rotation at the Veterans Affairs Hospital in Houston, I'd only read about it in my medical school textbook. Oh God, please help, our patient cried out. Yeah, hey, can we get him some morphine? Matt ordered the nurse nearby. Then he turned to me. Did you examine this guy? I recoiled at the thought. An exam would hurt, and this learning opportunity for me didn't seem worth the price of further pain. But I knew better than to question the rigid chain of command that framed my medical education. Hi, Mr. Sloan, I whispered, gently touching the man's shoulder. I'm Lisa, one of the medical students. I'm so sorry you're hurting. We just need to check your belly once more. He moaned again, but he rolled onto his back to allow me to examine him. The nurse is getting more pain meds right now, I said, helping to readjust his sheet and blanket, trying to keep most of him covered as I exposed the parts I needed to assess. Come on, the second-year resident interrupted. We've got to get this guy to radiology. Sorry, Mr. Sloan.
But how do I shut it off now? Wait.
The familiar little squeaks and gurgles that indicate a healthy and
It's working.
active
Thank you.
Nothing. I pushed down slightly, pulling back my hand as his abdomen tightened. He winced. Absent bowel sounds, I said to the resident, and he has guarding. Even I could tell Mr. Sloan had an obstruction. But the resident wasn't listening. Come on, hustle, hustle, he said, waving his arms as if to push me aside. He grabbed the metal sidebar of the stretcher and pushed it up into place. I jumped out of the way, thankful to see the nurse injecting more morphine into Mr. Sloan's IV. Within seconds, he relaxed. Sneaking a glance at my watch, I calculated the hours I had been at the hospital. Almost 18. Every one of my bones, muscles, and ligaments was tired. Calcaneus, talus, navicular, cuboid. I had learned all the bones in the feet, and each one of them screamed for a break. My day had started at 6 a.m. with hospital rounds. After visiting the 4 patients assigned to me and writing short notes, I had trotted behind the surgery residents as we stopped by to check on our patients under the care of our team. Mr. Rossi had been delirious overnight and had pulled out his IV. Mr. Peterson was asking for more pain medicines. Mr. Viciago's wound was healing well, and he might go home. A morning conference about the management of pancreatitis allowed me to sit for 30 minutes, but I spent hours standing after that, watching 2 hernia repairs, a splenectomy, and a longer vascular bypass procedure to improve blood flow to an ischemic, oxygen-deprived foot. Lunch was pizza in the break room, gulped down between surgeries. Dinner at 9 p.m. was cold pizza left over from lunch. The day was endless, and I was tired, tired of standing in place, watching as bodies were cut open and blood suctioned, tired of the stale air polluted by the smell of burning flesh from the cautery pen, tired of beeping IV poles and dirty jokes. I was also ashamed. Mr. Sloan was suffering. He was in the hospital without any family, being poked and prodded a few extra times for my benefit. He felt like his insides were exploding, yet I was bemoaning my sore legs and inevitable sleep deprivation. How self-absorbed of me. I was also trying to impress the more senior members of my team. I was programmed to seek their approval. I had been always driven to work hard and study hard, but my medical education had humbled me. It wasn't so easy to excel here. Even if I could cope with the long hours and respect the strict hierarchy, there was just so much to learn. During operations, the residents would grill me on my knowledge of anatomy, never my strong suit, and laugh in my surgically masked face if I didn't answer correctly.
He's afraid to get up.
What's this artery? The resident would ask, lifting a thin pink cord with a tiny laparoscopic tool during a gallbladder surgery, his harsh voice muffled. The hepatic artery, I'd guess? God, no, it's the anterior branch of the cystic artery. Remember Callot's triangle? How many times have we gone over this? I wasn't used to being incompetent, but no matter how many times I reviewed the illustrations in my textbook, I had trouble identifying the arteries, veins, and other anatomic structures during an operation. There was no glue in my brain for the intricate details of human anatomy. I trailed behind as the hospital orderly wheeled the stretcher to the radiology department. When the elevator door opened to the basement hallway, the second-year resident bounded out, followed by the attendant with the stretcher, and finally me, marveling at the resident's enthusiasm and trying to ignore every impulse to slouch to the floor. At the end of the short corridor, we turned into a room about the same size as a standard patient room, except with a large x-ray machine instead of a hospital bed. The machine loomed over a metal table covered with a white pad and sheet and illuminated by the glare of fluorescent lights. It was nearly midnight. White and gray, I thought. Except for the seafoam scrubs and the blue surgical gowns we wore, the hospital was devoid of color, almost like an old movie. Blood was the other exception. So, is there a connection between this guy's MS and volvulus? The second-year resident asked me while the tech started preparing Mr. Sloan for a barium enema. Yes, I answered, hoping I was right. Correct. MS increases his risk. And what are the other risk factors? I didn't know. Older age? Older age is a risk factor for nearly everything. It was a calculated guess. The resident nodded. Older age, chronic constipation, laxative abuse, other neurologic and psychiatric conditions, he recited. He must have memorized the textbook. So we're going to do the enema procedure first to confirm the diagnosis. Sometimes that'll straighten out the twisted intestine, but the patient will almost certainly need surgery after that to keep it from happening again. He may bleed, then we'll definitely have to operate. Mr. Sloan shouted out once more in pain as the orderlies moved him onto the thin pad on top of the metal table. He was tangled in the bed linens, and I could see his bony spine through the sheet. His suffering was acute and heavy. Intrigued and repelled, I wanted to comfort him, and I wanted to run from the room. But I was an obedient student, and I waited. The enema would confirm volvulus. If the patient agreed, we would operate. If all went as planned, we would return him to his usual state of health, or, in his case, to his usual state of severe, chronic, painful suffering. Even if we fixed the obstruction, there was no cure for MS. I stood nearby watching as this broken man was helped into a fetal-like position while a tube was inserted into his rectum. I imagined that once, decades before, he was young and vibrant. Maybe he liked the Doors and played basketball. Maybe he built houses or worked in a restaurant. Then he went to Vietnam. Did he leave behind a girlfriend or a young wife and child who celebrated his return? I thought of him coming home with big hopes for his future, only to have his plans sabotaged by MS, to have his body forsake him. My life had been sheltered before this surgery rotation. I had been spared such sights, such intimate connection with misery. Growing up in Austin, I lived with my parents and sister in a 2-story house with a front yard big enough for a slip and slide and games of freeze tag. My grandparents lived 2 miles away, and we visited every weekend. Everyone was healthy. We liked each other and got along. No car accidents, violent fights, surprise cancer diagnoses. I felt an urge to talk to Don, my boyfriend since college and a fellow medical student. I wanted to tell him about Mr. Sloan's case, to process this random cruelty. I wanted his help to understand this terrible disease that destroyed a man's life and left him with a potentially fatal surgical condition. I wanted his reassurance. Mr. Sloan's condition was rare. Maybe he would be okay. Don also might remind me that we had chosen to be doctors to help people, and we were learning how to do just that. But it was too late to call Don. He would be asleep. When Mr. Sloan's procedure was over, I returned to the break room, picked up my textbook, and settled down on an ancient couch to read about volvulus. I don't remember if I bid goodnight to Mr. Sloan, but I can imagine slipping by his room a little later, after I finally was sent to the call room for a couple hours of precious sleep before morning rounds. He was the first patient I had seen not only with volvulus, but with MS, the instigator of his abdominal obstruction and the cause of his devastating decline. I would have been relieved to see him sleeping, despite the glare of the vital signs monitor. I hope you don't bleed. I hope you don't need surgery, I might have whispered. You've been through enough. So, this was my experience of MS, and you can imagine that when I was diagnosed myself, this is where I went. This is who I thought of. But we'll talk about that in a minute. So let's go on. When I moved back to Austin before my diagnosis, we moved back in 2002. My first job was at People's Community Clinic, which I'm sure most of you know. People still think that I must work at People's Community Clinic, but I have been gone for 15 years. It was a great job. It was my dream job to be at a clinic working for people without private insurance right out of residency. It was also a very, very hard job and challenged me in so many ways I never even would have thought. After the People's Community Clinic, you can go to the next slide. Actually, before People's Community Clinic, Dawn and I got married. We actually got married our last year of residency. This is at a friend's wedding a couple years later, but we were glad to move back to Austin together. And then we had our kids, Ella and Clara. You're going to hear a lot more about them for my next reading. I also took a job at the School of Nursing Family Wellness Center, and that's the clinic that I write about in this book, although I don't name it. It was also an amazing opportunity to come on board for a brand new clinic. They had barely started seeing patients when I became the director. As exciting as it was also daunting, and I really got in over my head. But I did have a great team. This is the team that we built over the course of my time there, I was there for 7 years. Okay, next slide. So then on November 2nd, 2009, I woke up dizzy. I was 2 years into my job at the Family Wellness Center. I was also 2 years into having my second child, Clara. And that's why I remember this day. This was 2 days before Clara turned 2. I had a 4-year-old and a 2-year-old, and I woke up dizzy and had this crazy job. Next slide. So I was very fortunate that I was diagnosed in 9 days. It sometimes takes years to get an MS diagnosis, and it was thanks to my connections. I saw a neurologist, and then I saw an ear, nose, and throat doctor who ordered an MRI that made it clear that I had MS. MS is, as many of you probably know, is a disease of the central nervous system. It is known to be a leading cause of neurologic disability in young adults. In fact, it's most often diagnosed in people between ages 20 to 50, and it's about 3 times more common in women. There were no treatments at all until about 30 years ago. Now there are over 22 dozen treatments for MS. So we've had incredible advances. At the time of my diagnosis, I think there were about 6 treatments that were being used fairly commonly. I was fortunate that I was diagnosed at a time when there were options for treatment. The common symptoms I've listed there, they really run the gamut. Dizziness is not necessarily a common symptom, but MS can cause just almost anything, and I've seen so many different presentations. That's one of the reasons it's so difficult to diagnose, is that there's not one classic presentation. It can just come, and every single person has a different experience and a different presentation with MS. So when I was diagnosed, I felt like my future had been canceled. I was devastated. I thought of Mr. Sloan. I thought I have so much that I had so much potential with this clinic and with these kids, and now I'm not going to be able to do anything. I didn't realize there were great treatments out there. I really knew very little about MS. And it really was a challenge for me, for Dawn. It was a huge shock to us. And then I also had these two little girls to raise. Again, they were very demanding. Dawn was working a lot of, he's a hospital pediatrician out at Dell Children's. So he was working a lot of evenings and weekends, and I was often by myself with the kids. Next slide. So this next reading is about one of those experiences, which was about less than a month, probably 3 weeks after my diagnosis, when I tried taking my kids to the post office. And this is Ella and Clara about that same month that this story takes place. So this is what they looked like when we were in the post office. Okay. Here we are, I said to the kids as we pulled into the parking lot of the post office, feigning enthusiasm for a chore I mostly dreaded. I mostly dreaded it because I knew that the lines would be horrible and I would be impatient, and taking the kids anywhere was invariably difficult. But this little errand also brought a spark of holiday nostalgia. It was a connection to the past, a glimmer of hope. The line for the automated machine was much shorter than the line leading to an actual human postal worker, but it was still daunting. I took my place at the end, shifting Clara to my left side and letting go of her sister's hand. Ella stayed next to me until she caught sight of the Santa decorations on a window near the door and wandered toward them. Clara was squirming. "Down," she commanded. I set her on the scuffed tile floor, holding her hand as best I could. I watched as the person in front of the line pulled package after package out of her big plastic bag. It reminded me of a magic trick I'd seen at Esther's Follies, a popular sketch comedy club in downtown Austin. In the act, just when you thought the bag was empty, one more impossibly large item was removed: an umbrella, a crutch, a set of golf clubs. But this woman didn't have a magician's finesse and speed. She kept pushing buttons on the automated machine, sighing in exasperation. Inserting her credit card, after several minutes of fussing over the machine, she finally slapped a sticker on the package, pulling out another one from the box. I was sure the golf clubs must be in there somewhere. The girls were antsy. Having freed herself from my grasp, Clara joined her sister near the decorations, pointing and shouting, "Santa!" Ella tried to pick her up, but Clara resisted, and they barely missed being smashed by the automatic door. "Clara, sweetie, come here," I said, noting now that two more people had gathered behind me in line. Clara ignored me. She ran across the room, unconstrained, laughing. She narrowly avoided a collision with the woman who had finally finished her packages, the one I now thought of as Esther. Clara slowed for a second, reaching down to peel a sticky white thing off the dirty floor, a stray packing label most likely. I reminded myself to wipe Clara's hands as soon as we got back to the car. Frosty the Snowman was blaring through unseen speakers, and I tried to decipher all of the words so I could sing it, at Ella's request later that evening. Remembering the old cartoon movie from childhood, I pictured Frosty racing through the snowy village, chased by joyful children. This was no village, but it hadn't stopped Clara from turning into Frosty. Dashing around the post office, getting increasingly giddy in parallel with my own escalating embarrassment. After nearly slipping on the floor, she jumped behind a pair of orange cones concealed by plastic netting that blocked a dark section of the post office under renovation. She was oblivious, disobedient, wild. I was inattentive, incompetent. Surely that's what everyone was thinking. "Clara, you're not supposed to go back there," I said in a voice that I hoped was firm but still cheerful. She skipped out from behind the barricade and then jumped back again, taunting me. I grabbed Ella's hand. "Help me catch your sister," I whispered. Then I turned to the person behind me, mumbling, "1 sec." I stepped away, mortified, to scoop up my unruly child. "Clara, this isn't a game." I lunged, grabbing her around the waist and carrying her sideways, screaming, back to the line. As my upside-down child tried to escape, I stepped back out of the line into the view of the people in front of me. Everyone had things to do, and I didn't like to ask for favors. I was ashamed. But I was dizzy, worn out, desperate. "I am so sorry, but could I possibly go next?" I asked, hoisting Clara up again. "I'm just getting stamps. No packages. It'll just take a second." I smiled, grimaced really, hoping that I didn't come across as needy or, worse, entitled. The young woman at the front of the line pulled a fancy wallet from her fancy handbag and fiddled with some bills. Looking at me, she shrugged. "That's all I'm getting too," she said. Then she turned her back on me. Of course, this was the way my life was now, the way it would always be. I was near tears. "Have mercy," I silently pleaded. "I can't control these kids, but I'm trying. I have MS. Each day I wake up terrified." I wanted to ask her to show a little charity to remind her that it was Christmas and maybe one day she might need help. And the laws of karma were not on her side. I also wanted to punch her in the face. All right. So definitely one of the biggest challenges was trying to manage everything with my kids. I ended up reaching out to friends and family, scheduling people to come and help me in the evenings. I did manage to make it work, and my kids are doing great now, and I'll show you some pictures of them later. But I also had to learn to become a patient. So that was one aspect with the kids that I was navigating, but I also had to learn what it was like to get an MRI, what it was like to get medications delivered, what it was like to sit in a doctor's waiting room and not know what the results were going to be of an important test that would really tell me my destiny. And becoming the patient while I was working in a clinic for people who were uninsured was incredibly insightful for me about our healthcare system. That's another thing that I write a lot about in this book is the incredible differences between the care that I received as someone who was white and educated and insured and had resources versus my patients who were often people of color, who did not have funding, didn't have an education, and they had to wait for care so much more than I did. I had a woman who had to wait 2 years to see an ear, nose, and throat specialist, whereas I was able to get in to see an ear, nose, and throat specialist, call him up on his cell phone on a Sunday afternoon, see him the next day. The differences between my care and theirs was dramatic and all the more stark when I was the one seeking care too. So let's go to the next slide. This is a chapter about learning to be the patient, and I think it's something you will all be able to relate to. It's called Your Call is Important to Us. And this is the last reading that I'll do. October 2010. So this is about a year after my diagnosis. "Thank you for calling. We apologize for the delay. Your call is important to us. Please remain on the line and your call will be answered in the order it was received." My MS medicine was late. It should have arrived the day before in a big cardboard box with my name on it. I was glad I still had a week's supply at home in my refrigerator, but I didn't understand the delayed delivery. Most MS medicines are specialized medicines that are only available at specialized mail order pharmacies and cost about the same as a mid-range used car for a 3-month supply. Fortunately, I had an insurance company that covered most of the cost, and a specialized pharmacy usually got the medicine to me on time, packed in a large styrofoam cooler as if they were delivering a new heart or kidney. Now, after navigating a phone tree that felt like a corn maze, I was waiting for a live human to pick up the phone. "All available representatives are assisting other customers. Please stay on the line for the next available agent," the cheerful recorded voice on the other line said. Of course they are. and I can tell my call is very important to you. After all, I've only been waiting for 16 minutes, I said into the receiver. Then I heard the music again. The music, computer generated with forced jollity, was grating, barely more pleasant than Ella's whines when I tried to get her to practice piano, which she did stop doing after a while, and we quit. Thank you for calling. Enjoy your wait, pharmacy. How may I assist you? Another cheerful voice, this time a real one, said on the other end of the line. Yes, hi. I was calling to clarify why my medicine didn't get delivered yesterday, I said, faking cheerfulness as well. I should be able to help you with that. May I get your name and member ID? I gave her both. Thank you. Please be patient 1 moment while I look you up in our system. I waited. At least she didn't put the hold music back on. I apologize, but I'm not finding that member ID in our system, she said after a minute or two. Well, I have it right here in front of me. I repeated the number, and she confirmed that was what she had tried. I imagined my patients trying to get refills, schedule radiology tests, pay hospital bills. Navigating the phone tree was hard enough for me, and I spoke English and had postgraduate degrees. I was a doctor, and it was still exasperating. Let's try looking you up with your date of birth, she suggested. Why didn't we just do that in the first place? I gave her my date of birth, waited another minute, and felt genuinely cheerful when she said, here you are, Lisa Doggett, and oh yes, your member ID is here too. You're not supposed to include the T in front of it. Then why did they print a T in front of the number on my card? Oh, it must be a silent T, like the K in the word no. I should have known. But we were getting somewhere, and I kept my mouth shut. So, which medication were you calling about, she asked. I only have one for my MS. It was supposed to be delivered yesterday. Okay, yes, for that medicine, you will need to speak with Phone Trees RS Pharmacy. They're the ones who handle deliveries for specialized medications. I'd be happy to give you that phone number, she said. My frustration building, I dialed the new number. Perhaps I should have known which pharmacy to call. I had called the pharmacy number on my insurance card first, not giving it much thought. But I was now learning from personal experience what my patients, at least those with insurance, had been telling me for years. Dealing with insurance companies was not intuitive, efficient, patient-centered, or friendly. Thank you for calling Phone Trees RS Pharmacy. Please note that our menu options have changed because they have always changed, right? Please listen to the following options before making your selection. Here we go again. The new phone tree was like a choose-your-own-adventure book. Did I want to listen to the message in English or Spanish? Was I calling about a new prescription or a prescription refill? Did I want to make a payment, arrange for a shipment of medication, update my contact information, or speak with a nurse or pharmacist? I clicked 8 on my phone to check the status of an order. Did I want to update my shipping address, update my payment address, update my insurance information, or report a problem with my order? A problem with my order, yes. I clicked the 4 and was promptly disconnected. With a deep breath, I called back, furious, but trying to remain calm. When the phone tree started again, I refused to climb. I just kept pushing 0, hoping to get an operator. Instead, I kept getting rerouted back to the same menu. I felt like I was trapped in a sticky web. I had to listen to the phone tree options again, ultimately selecting speak to a pharmacist. At least I could hopefully get a person on the line. We are experiencing an unusually high call volume, again, like always. Please remain on the line, and the next available pharmacy staff person will assist you. About once a month, I actually took a lunch break. This was my break. I pounded my head on the desk. At least the hold music was marginally better. It sounded like an easy listening radio station, Christopher Cross or something. I clicked through some patient tasks on my laptop, though I was distracted by my own frustration. It didn't help that I was dizzy that day. In addition to robbing me of creativity and motivation, dizziness sucked dry the tiny petal of patience with which I had started the day. At last I heard, "Thank you for your patience. You will now be connected with an agent. For quality assurance purposes, your call may be monitored." To my great relief, a real live person spoke. Good day. Thank you for calling Phone Tracer Us Pharmacy. How may I help you? I provided all my requisite numbers, told my tale of woe again, and I arrived home expecting to see the box with my medicine on the front porch, but it wasn't there. And I waited some more while the pharmacy tech researched my situation. It appears your prescription was canceled, she finally said. What? Why would my prescription be canceled? The old prescription expired. Your doctor has not sent in the new prescription, she explained. At least I think that's what she said. I struggled to understand her thick accent, imagining her far away, halfway around the world probably, trying to help me with my prescription refill. Maybe people who answer phones for these large companies are intentionally far away so that enraged patients don't try to track them down. Well, that's very interesting. Why didn't someone call when we scheduled the shipment last week? Why didn't you all call to tell me the prescription was canceled instead of just failing to deliver it? We do apologize for the inconvenience, ma'am. Look, I know this isn't your fault, but can't you make an effort to contact me, to contact any of your customers who are expecting a delivery when the prescription is expired? I asked. You all called me last week to arrange the shipment. Why did you call me if the prescription was invalid? It felt a little weird to be doling out business advice, but this company clearly needed it. I mean, if I don't get my medicine, my health is at risk, I added for good measure. I wanted to go on to share that I was the parent of 2 little girls, that I needed to be able to take care of them, not to mention my patients, but I knew it was pointless. We apologize, the agent said again. So what do I need to do now? Call my doctor? Yes, your doctor needs to send another prescription, then we will contact you about the delivery of the medicine. I got the fax number that my neurologist staff would need to send in the refill, and I hung up. You've got one, Sarah Maria, my medical assistant said, referring to the first patient in afternoon clinic. Do I have time for another short phone call? I asked. I think so. It will just take a few minutes for me to get her back to an exam room, Sarah Maria said, my medical assistant. I found Dr. Reynard, that's my neurologist, his office number in my phone, and hit the call button. After multiple rings, a recorded message came on. We are unavailable to answer your call at this time. Our office is closed for lunch. Please try your call again later. I couldn't even leave a message. I slammed down the receiver, and when I called a few hours later, after I had finished seeing patients, Dr. Reynard's office was closed. So I'm sure you all can relate to that experience. But this is something that I definitely had to go through and continue to have to go through on a regular basis due to my MS diagnosis. Our healthcare system, not very friendly. Thank you. It's definitely something I think everybody has experienced, and it's not a system that any of us find enjoyable to deal with. So we'll go to the next slide. So I wanted to just point out some of the lessons I've learned as a doctor turned patient, as someone living with a chronic condition like MS. I think self-advocacy is absolutely critical. I think you all, I'm sure, are good advocates for yourselves and for other family members. But it's something I really had to coach my patients on, because a lot of my patients didn't have that, and that didn't know that they could be advocates for themselves, didn't have the confidence or the even the language skills to be able to be advocates. So often I was the one really helping to fill that role for them. I also have learned to live with uncertainty. And I think, we all live with uncertainty, but when you have a chronic condition, especially something like MS that is just notoriously unpredictable, it's something that we all have to learn to deal with. And I've really learned to make peace with it in a way I never would have thought possible. Mindfulness, that's part of living with uncertainty, but mindfulness, for me, it was mindfulness meditation, but also this concept of mindfulness, of really living in the moment, also just noticing everything around you in that moment. And my teacher's expression is, this is the way it is right now. So just kind of this acknowledgement and acceptance of where things are, how things stand, so that now when I have my day where I'm dizzy with MS symptoms and not feeling well, I can just say to myself, this is the way it is right now. Self-care has been really critical. I've made sure that that's a top priority for me. For me, that looks like exercising every day, finding time to write. I write in a journal every night, and writing this book was a real therapeutic experience for me. I kept a journal since I was 11 years old every day. I've missed about 5 or 6 days ever. And I use that to help write this book, but it also is something that I use on a nightly basis to help me process what's going on. The healthcare system disparities, this was a big one. Certainly, I've mentioned it. I write a lot more about that in the book. There's a lot of patient stories in there about the experience of me trying to help people and their experience of trying to seek care in a system that doesn't really care in a lot of cases. And then to prioritize what's really important, to really get my priorities straight. That's been another important lesson. Making sure that I take every opportunity I can to go on that bike ride with my parents. We try to do that every weekend. To set aside my laptop, which I am often glued to spend time with my kids and with Dawn, to make sure that I really keep my relationships first and foremost. And overall, my mantra is do more and do it now, because I don't know what tomorrow will bring. Next slide. So I think another lesson I wanted to give its own slide is the importance of connection. And that's one of the reasons I really love this whole organization. This is great. You all are connected with each other. You're here today. You're here on Zoom and connected with others. But we know that connection is critical to health and to overall well-being. One of the things that I'm hopefully just finishing up is my lifestyle medicine board certification, which is a new specialty within medicine, focusing on diet, nutrition, exercise, sleep, the things you would expect. But one of the tenets of lifestyle medicine is connection, because we know that is so important for health, not just for, feeling good. It actually really has been linked with improved health outcomes with reduced mortality. Next slide. I've been really fortunate. This book ends in 2016, so I'm going to update you all a little bit. I've been very fortunate to do well with MS, and particularly the last 7 years or so, I've been stable with no more symptoms, no new symptoms. I do still have dizziness and some other symptoms here and every now and then, but I've been able to really lead a pretty normal life. We have great new options for treatment. I am on infusion therapy every 6 months. And I have a great physician as well as medical team. I have wonderful family support, and I've been connected with the National MS Society. The picture there in the middle is me riding the MS 150, which is a bike ride that's actually about 160 miles from here now to College Station. It used to be from Houston to Austin. My mom now joins me in those rides, and we ride every spring. My husband has gone with me once as well, and hopefully we'll be back this year, maybe. But connecting with the National MS Society has been a really great opportunity for me to meet other people with MS who are at all different stages of illness, and to be able to support each other, as well as to really have fun with the MS 150. I also blog for the National MS Society. That was the other picture. And this is my family. So you can see Ella and Clara, as well as Dawn. And we have, in the spirit of do more and do it now, we took a really amazing trip to Australia this last summer. So here we are at Uluru in Central Australia. This was to celebrate my 50th birthday, Ella's graduation from high school. And it was a pretty amazing opportunity to be together and explore and travel. So that's it. I appreciate it, your attention. I'm very happy to take your questions and appreciate the opportunity to be here.
Thank you.
Other one.
Now hear this. Thank you. What are your questions? I've brought Tom, of course, as usual, 3 or 4, but we have people in the audience, Lisa, who have MS. We have people who support the diagnosis. We have people, as you could easily guess from your own practice, who have a number of chronic medical conditions. Even the healthiest guy like me took 4 pills this morning. That's the nature. But questions? Sam?
Yeah, my camera fouled up when I was trying to take pictures of that when it was diagnosed, and it told you all about that type deal. Where do you get a copy of that?
Oh, I just wrote that myself, but the National MS Society has great material on national nmss.org. But if you want to go back to that, I don't know if can you go back to that slide that talks about MS? I don't know if we can. I'm happy to share it with you just as a screenshot. Sure. I think you're talking about the one that has MS, right? I think it's like, yeah, go back about maybe 8 slides. Keep going. Back. Yeah, keep going back. Keep going. There we go.
We'll try to get a copy of those also, as Libby suggests. Those are accessible kind of information. You've been critical, appropriately so, of the U.S. healthcare system. You kind of summarized some things. You have an unusual perspective coming from people who make policy, as well as both of the things you've talked so much about. Is there one or two things that you would say are our most outstanding need for change?
Well, we definitely need to prioritize getting universal access to care, and that includes, everyone. We are the only
In other words, everybody have insurance or some
everybody
program.
have some access to care, whether, I mean, I think, the Medicare for All proposal is reasonable. We need to have a system that grants care for all. And unfortunately, right now, we have in Texas the highest number of people without insurance. It's almost one in 5 people in Texas has no insurance, no coverage. They can sometimes go to community clinics, but as you know, that's so limited. I was in a clinic where I could see them, but I couldn't do tests. Hardly any of my patients ever could get an MRI at all. They couldn't specialists, they couldn't get medications they needed. And those are the people that actually got in the door. There are people that don't even have access to a clinic like that. So I think that we need to prioritize that. But what I was going to say is we're the only industrialized nation that does not have universal access to care, and our outcomes are much poorer in many ways, like mortality rates compared to most of those other countries.
Right. And even as our current system exists, they're just people who fall between the cracks because they don't have a green card or other aspects. I mean, Lisa could go on and on about people who just don't have the ability, even much less the resources, to access care.
Yeah, thank you.
Bob, hang on just a second.
I noticed one of the symptoms was depression. Is there any more you can add to that and how effectively to handle it?
Yes, I'm happy to. Depression is more common in people with MS. We don't know if it's a result of some of the other symptoms that people experience that they get depressed. A lot of the medications that are used to treat MS also have depression as a side effect. So it's something that many people with MS struggle with. I've had varying degrees of depression throughout the course of my illness. It's always been pretty mild. I've had depression, actually more significant depression before my diagnosis when I was in medical school. I had a really tough time and when was on medication, but I haven't needed medication in a long time. I think actually I call exercise my antidepressant, and there's true evidence to support that. Exercise is as effective as medicine for mild depression. But it is a very, very tricky thing to deal with. I think that when I go to I was talking about lifestyle medicine. So from a lifestyle medicine standpoint, we talk about, having a really healthy diet, lots of fruits and vegetables that actually can reduce the risk of depression and anxiety. There's some connections there. Exercise, absolutely key for handling depression, as well as it's very helpful for anxiety. Making sure you've got adequate and high quality sleep, another tricky thing, but that impacts depression. Connection with others, very important. Avoidance of unhealthy substances like too much alcohol, prescription medicines, those can all impact depression. So there's a lot of things we can do from a habit lifestyle standpoint to help reduce the risk of depression, to treat depression, but also certainly psychotherapy, counseling, as well as medications have an important role for many people.
I think the important thing there, as you would tell me, is just acknowledging it's a problem and say, okay, I need hearing aids, I need antidepressant access.
Absolutely. Yeah. I mean, I think Well, one of the reasons I want to talk about it is because there's still stigma attached to it. There's stigma attached to MS. I had a patient recently. I was working with a neurologist at the MS clinic, and she'd had MS for 8 years or so and hadn't told anybody other than her husband and a sister. That's a good one. But she was too embarrassed to even tell her physical therapist, who she was seeing for MS symptoms, that she had MS. Because there's so much stigma, and mental health problems are even worse. I mean, I will be up here and say, I'm currently not experiencing depression, but I have experienced it in the past. I had to take medication for it. It's very hard and it's very common. And I'm sure some of you have either experienced it or have others that have experienced it. And I think it's good for us to be able to talk about it and help each other to cope. It's tough. Oh,
My wife and I got married, and 2 months after that, she came down with diagnosis of MS, very young. And over the years, we've experienced remissive and aggressive periods. But when we were young, say 71, 31, up to say the last 10 years, we hardly had any problems with MS. Then we started having these waves of aggressive and remissive, and it's an experience to go through.
thank you for sharing that. Yeah, MS is so unpredictable. And I think one of the things that was really frustrating for me is that there's often not much you can do about it. So, there are certain conditions, I mean, heart disease and high blood pressure, for example, like those actually improve a lot with exercise, with, reducing your salt intake, with, diet. MS is not as affected as many of these other conditions are by habits and by your own choices. And so there's often real limits, and it just is something that you just can't control. Fortunately, again, there are medicines. I imagine when your wife was diagnosed, there weren't good treatment options. We've really had some medicines come out that have been game changers in the last 7 years. So I switched medicines in 2017 and have that's been made a big difference for me. I haven't had any more relapses.
Again, thank you for coming and being with us. What message were you trying to convey to the world by writing this book? You had lots of time to think about it, over 12 years.
There's lots of messages, I think, in that book, but well, I think there's a couple key messages. One is that, everybody goes through challenging times, and when I was first diagnosed, I again felt like all the doors were shut, but yet so many good things have come out of what was a real difficulty. So I think, having some faith that there are lessons to learn, and there is some good that can come out of a difficult situation. I think that's one of them. Another one is certainly, like, we really need to take care of everyone in our society with a better healthcare system. So I would really urge everyone to be politically active and engaged and make sure that we are doing everything we can to promote universal care.
Amen. I was struck in your book, and I think we've all probably experienced it, when you have a new diagnosis, when you have an exacerbation of something. I was struck by the word you chose, fragile, that you just felt fragile.
Absolutely. Anybody?
Arnie?
Do you think there's anything that can be done about the phone tree problem? And let me tell you why I bring that up. I think the phone tree problem killed my father. Their parents were living in Florida. My father turned out he had congestive heart failure. But as he got further and further out of breath, kept trying to call his primary care. And he eventually gave up. Now, I'm visiting him. I tried to call him. You make the call, you get on hold because you're going to talk to a person at the desk. The person at the desk tells you to go call the nurse. You get on hold for the nurse. The nurse says, you tell the nurse you want to talk to the doctor. Well, you can't do that until anyway, on and on and on. And eventually he gave up. He just gave up, so that I think it was just so hard for him to get in touch with a human being that he said, to hell with it. And what can we do about that?
No, it's a good question. I certainly welcome your thoughts. I think that unfortunately doctors, I was like, tell your doctor. And I think it's good to tell your doctor, but your doctor's often unable to do anything to change it either. I think it comes from a higher level. I think it's often administrative decisions. It's cutting costs. Hopefully AI may help us in this regard. Patient portals, which I still think are totally frustrating, and I always can't find my password to to log into my patient portal. Hopefully we will eventually get those to work better so that we can make appointments without having to even call in. I mean, I think we need to continue to raise this issue with administrators, with doctors, but there's not an easy solution. I mean, and it's not just in healthcare, right? It's like calling to make talk to someone in the airline to your flight information. It's totally frustrating.
Why don't doctors take emails? Where you have all this data, the history and everything.
Yeah.
And they say, sorry, we can't take emails.
There's a lot of privacy concerns around emails. I know we've struggled with that in my last job, and it's a huge limitation. I don't understand why it's taken the healthcare profession so long to kind of catch up with technology, but we really haven't come up with a good solution to that in many cases.
One more question, and then we'll
Arnie-
kind of settle it down.
Think, Arnie, I started trying to get a medication filled Monday, and it said 3 more refills. And I called my pharmacy and they said, well, we will have it to you by Wednesday at noon. And then I got a message it had been delayed because they hadn't heard from the doctor's office. And I think I called the doctor's office twice and didn't get a response. And so Friday about 11, I went to the doctor's office. And they said, your PA has to do that. And I know the PA and I know the physician and I like them. And I said, the nurse called me into the consultation room. And I said, well, can I go see the PA? Of course, I instantly got a no. And then she said, I will text him. And I said, well, you put a fire under him, please. And she kind of looked at me like I was crazy. But after you do that, wish him Merry Christmas, but please get my prescription. It's important. And so in 3 hours, Friday afternoon, I had my prescription, but there's
advocacy.
Yeah, but not many people could do that. That's the unfair part.
That's the unfair part. That's a great example. Thank you. And that is, I would absolutely tell everybody, do what you did. That was brilliant. But unfortunately, yeah, a lot of people don't know how to do that.
I don't think they were happy to see me.
That's okay.
Bob, you have one question, and then we're going to let the rest of it be informal.
Actually, just a plug for the VA, which I'm going through on the phone tree. The VA has where you can send confidential emails, text, and usually within a day you'll get a response back, or
Right.
if not a phone call back. And same thing with the pharmacy. So it can be done. Now, I'm sure funding has a lot to do with it and where the money is coming from and going to, but it can be done.
Thank you, Bob. We needed that. But the whole point is advocacy can bring it. We've made a big point here, Lisa, within our organization where the member asks for it to send one of our other volunteer with them to be their extra ears and
Great.
have Mark's personality of aggressiveness there. But anyway, thank you.
Is there anything
Thank
on
the
Zoom
Doggett
that we need to-
members for being here.
Dr. McCourse, is there anybody on Zoom that we need to, are there any questions or anything? I don't know who's on Zoom, but.
No, thank you for bringing that up. I think not. I mean, there are people there, but they are not speaking
Well,
loudly.
thank you if you're on Zoom. Thank you for joining.
Oh, Carol Carl. Sick.
I will sign some books. We have books for sale. We just matched the price from Amazon, and it's $18.35. We can check, cash, credit card, Venmo, PayPal, whatever you can think of.
Right. It's all waiting. And again, thank you. Bye-bye.
Thank you.
Oh, Carol Carl